Difficulty swallowing or dysphagia can be life-altering. It affects nutrition, hydration, breathing, and quality of life. Yet many patients struggle to access proper evaluation and treatment. A recent national study looked at dysphagia care in the United States and how access changed after the Affordable Care Act. The findings were encouraging, but also revealing. Insurance expansion improved access to swallowing evaluations, speech therapy, and specialty care, especially for older adults and lower-income patients. And why does this matter? Because dysphagia isn't just uncomfortable. It increases the risk of aspiration pneumonia, weight loss, dehydration, and hospitalization. When care is delayed or unavailable, patients often end up in the ER instead of in a clinic where the problem could be managed safely. In practice, I see patients who lived with swallowing problems for years before getting evaluated. Not because symptoms weren't serious, but because they didn't know where to go or couldn't even access appropriate care. This study highlights that policy changes can directly affect patient outcomes. When patients can see specialists and undergo proper testing, when they can work with speech-language pathologists, the complications decrease and quality of life actually improves. Dysphagia care teams are important. It often is made up with ENTs, speech therapy, primary care, nutrition. Everybody plays a role. Access matters just as much as expertise. So if swallowing feels difficult, painful, or unsafe, it's not something to ignore, and it's not something you should have to navigate alone. I'm Dr. Morgan Yost, helping patients understand how to access care and how that can shape real healthcare outcomes.